The symptoms. Salmonella infection is usually caused by eating raw eggs or meat products that are contaminated with the bacteria. There's an incubation period of a few hours to up to 2 days, followed by symptoms that can usually be classified as gastroenteritis, an inflammation of the stomach or intestines. The most common symptoms of a salmonella infection are the following: vomiting, nausea, diarrhea, chills, fever, headache, blood in the stool, very hot temperature, cold sweats, head cold, runny nose. 2. Know when to see the doctor. While salmonella usually doesn't pose a high health risk, individuals with compromised immune systems, such as people with AIDS, sickle cell disease or inflammatory bowel diseases, are at an increased risk of complications from salmonella poisoning. Children and the elderly are also more likely to experience serious complications. If the symptoms don't seem to be ebbing, and the person experiencing them is in a higher risk group, it's advisable to see a doctor as soon as possible. Immediate medical attention should also be sought if you're or the person you're concerned about experiences the following: dehydration, leading to decreased urine output, decreased tear production, dry mouth and sunken eyes. Signs of bacteremia, a condition in which the salmonella enters the bloodstream and infects body tissues in the brain, spinal cord, heart, or bone marrow. A sudden high fever, chills, rapid heart rate and an appearance of serious illness are signs that this may be occurring. 3. Get tested for salmonella infection. The doctor will assess your symptoms and in most cases advise getting plenty of fluids and resting until the symptoms pass, since they usually go away on their own. If the doctor determines a test is necessary, a stool sample will be tested to determine whether it contains salmonella. The doctor may also decide to test a blood sample to determine whether bacteremia has occurred. The doctor may prescribe antibiotics if the salmonella infection has spread beyond the digestive system. If dehydration becomes severe enough, the patient may need to be admitted to the hospital to take fluids intravenously.